Hello, everyone. Um, Good evening and welcome to Nivarana's Public Health Forum. For those of you who are hearing about Nivarana for the first time, Nivarana is a public health information and advocacy platform that was started in 2022. We aim to bridge the gap between public and public health by making complex information accessible and easy to understand. We wish to empower people with the right information with the hope that more people would begin to be bothered about public health practices in the country, understand what is lacking, and ultimately demand for the right things to change. Public Health Forum is one of our initiatives where we have solution oriented discussions of problems with experts in a panel and an audience. I'm Christianis. I'm the co lead editor of Nivarna. In my day job, I'm an internal medicine physician and a freelance health journalist. And I'm extremely happy to invite all of you to a crucial conversation about heat and health. Before we begin, let me introduce you to our amazing speakers. Um, First is Dr. Gayatri. Dr. Gayatri is an emergency medicine physician and a public health worker. She's a talented illustrator who is committed to demystifying, decentralizing, and democratizing health information via illustrations. So, in order to transcend language barriers and to amplify the voices of the unheard and the underprivileged, she uses illustrations. Her aim is to bring critical issues on health to the public consciousness and to therefore empower communities to have agency over their own health. The next speaker is Aatmika. Aatmika Nair is a researcher and a co-director of ASAR, which is Association for Socially Applicable Research. Her areas of interest in research include climate change, violence in healthcare, and in mobilizing human resources for health as well as infectious diseases. Our third speaker is Mayank Aggarwal. Mayank is an investigative journalist with almost 2 decades of experience in covering the intersections of energy, environment, climate change, development, and technology. He's now a trustee and editor at the Reporters Collective, which is a Delhi based investigative news platform. He also works as a media trainer and a community journalism mentor, educating students and journalists alike on climate change. Finally, we have Lara Jesani. Lara is a lawyer. She practices human rights law at the Mumbai High Court. She's part of the PUCL, which is People's Union for Civil Liberties, which is a national network on civil liberties and democratic rights. She's also a part of several other human rights and feminist collectives. Her special interest is in environment law and climate activism. So, with this expert panel of speakers, we aim to deal with the critical issue of rising temperatures. As you know, India has crossed record temperatures in the past 2 years of 2023 and 2024. And the number of heat wave days has been increasing exponentially. Secondary to that, a lot of people are developing heat related illnesses like heat stress and heat exhaustion. And there have been a lot of heat related deaths as well. The current numbers that talk about heat related deaths are actually quite conservative, considering that there has not been adequate reporting surrounding this issue. So, just as summer is about to start, this is a very relevant topic. So, my first question is to Gayatri, who will be talking about health effects and clinical burden of heat now. How does extreme heat affect physical and mental health? And what are the populations who are most at risk?
Thanks, Christianes. So, in all our bodies, just like in a refrigerator, there is a thermostat. I'll try and make this as simple as possible. So, whenever the temperatures go beyond a certain range in that thermostat, the thermostat will assess it and then try and bring it back to the temperature that the body is comfortable with. So, when temperatures rise, let's say, for example, in a heat wave, our body will work hard to cool itself, which will be usually by sweating. So if beyond a certain point, the thermostat stops working, and then the body's ability to control temperature comes under serious stress. So this can lead the body to feel uncomfortable. This is when we start feeling uncomfortable. And then there's a range of conditions which starts with cramping, heat rashes, tiredness, dizziness, just feeling like you have a very fast heartbeat. Sometimes people will faint, they'll get confused. And then beyond a point, you can reach a place where you will have something that is commonly referred to as heat stroke, which means that you will feel hot and dry, your mouth will become really dry, and you can completely even stop sweating. So sweating is not a good indicator of whether you're suffering from heat illness or not. You could suffer, you could not, you could sweat and you could not be sweating. If your skin becomes hot and dry, you become confused, and you are not able to stand, you have dizziness, then this is probably what you're experiencing is a heat stroke, which can be a life-threatening emergency. So this can happen slowly or it can happen suddenly. It can sometimes not be obvious in the beginning. And usually our vulnerable population is um, people who are elderly, obviously children who have just been born, and pregnant women, but also speaking in terms of the socioeconomic demographics, people who are migrant laborers, construction workers, anybody who is doing outdoor work, informal labor, even our domestic workers, domestic help staff. These are usually people who are very prone and very vulnerable to heat related illnesses. And it's more that before the physical symptoms start, very often we start feeling the mental effects of heat, which are we tend to ignore them, but they are extremely valid and legitimate, and they do affect the hours of work, our quality of work, and therefore um productivity of any kind. And it's one of the first few signs of any kind of heat related discomfort. So, just to wrap this up, there is nausea, headache, muscle cramps. These signs should not be ignored. Sweating, and it's not necessary that some heat related illnesses will happen only in hot weather. It can also happen in, let's say, in the monsoon. But if you're working really hard and you haven't hydrated, or you've forgotten to hydrate because of the temperature outside, then it can occur even then. And pregnant women who are breastfeeding, children, elderly people, and anyone doing any kind of work outside or in places with limited ventilation are all vulnerable to it.
Okay. Thank you so much for telling us about the symptoms and how and why heat-related illness occurs, Radhika. Sorry, Gayatri. I am moving over to Mayank to ask about city design and ask you about how current cities are design. Is it helping people cope with the rising heat, or is it hindering? Could you tell us a little bit about that?
Sure. Thank you so much for having me. Thanks, Gayatri, for setting the stage. Let's start with understanding where we are in terms of the urbanization, just to give you a perspective. We are about several hundred millions of people are living in the urban areas in India. And over the next 20 years, we are looking at adding several hundred millions more. So we are looking at about 300 to 400 people being added to the urban population. And the way we have planned the cities so far, the examples of the cities, the trends that we have seen so far, all the million plus cities that we have in India, uh, say about several dozens of them. And if we look at the planning has, despite we trying and we coming out with policies, the implementation of these policies has not been up to the mark in terms of developing the cities to manage the urbanization impact and then also manage how the heat, increasing heat and the intensity of the heat is going to be managed or not. So I'll say we have ideas, policies in place, but the implementation of those ideas and policies has not been up to the mark. And sadly, the story, despite all the pom pom, everything about, talking great about the policies or say talking about the grand plans of creating smarter and happier and more energy efficient cities, on the paper, it is yet to be done.
Can you tell me a little bit about what things in existing cities actually worsen the experience of heat for people?
Let's say it's not just one thing, there are so many. We have areas of congestion, we have the decreasing green cover, the amount of concrete being used, the poor planning in terms of what kind of what kind of material is being used for construction, how the cities are being planned, the water bodies. So it's not just one. It's like we also have to see who gets impacted. Let's say in an urban area, because of the intense heat, people start using more air conditioning systems or more system cooling solutions. So if the cooling solutions are not sustainable and are not in accordance that they spread more heat, you see in areas which are using a lot of these cooling systems and less green cover, you see the temperature going up in those areas, the urban heat island effect that we see. And if we start connecting these dots, one thing leads to another. It's like a domino impact, you know, impact on people who are vulnerable, who are on the streets. So there are no, if you just look at, let's say, 15 or 20 major Indian cities we look at, most of the major Indian cities are lacking the green cover. We are increasingly concretizing those areas and adding more houses because there is a huge demand for urbanization. Look at how Delhi is expanding and reaching out the satellite cities. The areas which were green between Delhi and satellite cities are now all concretized. So the problem with us is the solutions that are there or solutions that the different countries or different cities across the world are adopting to battle or to mitigate the urban heat island effect. We have some of those, but we are rather incorporating them or valuing them. We are cutting them down or we are letting go of them.
Okay.
And we have to remember who gets impacted the most.
Can you yeah, could you please continue that line of thought on who gets impacted the most?
See, if we look at the profile of the people, ultimately, when we talk about the urban heat islands or the urbanization impact on and how it is coping up with the heat, increasing heat, it's the people, the poor and the marginalized, because people with resources are still able to use some kind of cooling solutions, but the others are not able to do it. And it is not just it's the conversation or the battle is not just then limited to the day. Increasingly, studies are showing that the nighttime temperature is also increasing. The wet bulb temperature is also going up. So, what happens to the people who do not have the resources? It becomes a cycle for them. In the daytime, they are suffering from that. And then I'm not even starting the conversation. Like, there are so many doctors, I'm sure they will talk about it. But I'm not even starting the conversation that impact of daytime intense heat and the nighttime high temperature on mental stress, on respiratory issues. It's like as I said, it's like a domino impact, and it keeps on adding. There is no solution. It becomes a vicious cycle for them. But yes, it's especially the poor and the marginalized. And let's talk about women, the role that women play, whether no matter which class or caste they belong to, the impact, especially on women. It's a separate conversation altogether.
Okay. Thank you so much, Mayank, for talking about urbanization. There's also this thing that we had heard about electric grid failures due to high heat, which then also makes a lot of cooling measures unavailable to people during long stretches of time as well. As you rightly pointed out, it's a lot of impact on the poor and the marginalized as opposed to people who have the means to cool themselves. Speaking of this, I will move on to Atmika, who will be dealing with system readiness for heat, and ask her about how prepared is our public health system to respond to heat waves and such emergencies, especially because the most vulnerable populations, as we have established, are the marginalized, and they're going to access healthcare from the public health system. So,
I apologize for the background noise. I hope I'm audible. Kashanis, can you confirm?
yeah, you're audible.
Thanks. All right. Thanks to Janice for setting the entire context for today's panel discussion. Okay, so I'll just start with first policy. So in terms of policy, right now we have the national program for climate change and health started in 2019, which has laid out a very in-depth and detailed health system studying that would be required for preparedness to deal with heat-related illnesses. And heat is something that at least in the health department and within the program itself is given very high priority with extensive coverage of heat related illnesses covered across action plans, not just at the national levels but also at the subnational levels. And they've also come up with an extremely they comprehensively mentioned how management of heat-related illnesses happen among pediatric and elderly population as well. So they've divided the entire guidance into pre-heat season and the heat season. So in pre-heat season, what they expect is that you do vulnerability mapping, hotspot mapping. We kind of come up with IEC materials, awareness, and constitution of a rapid response team for exigency calls. During the heat seasons, you have setting up of heat stroke rooms, ensuring whether the temperature data is coming from IMD or not to the health facility, SOPs for cooling measures that need to be undertaken, logistics required to kind of combat that. And we also had a separate national action plan for heat-related illnesses that was released in 2021, particularly that dealt with differential diagnosis of heat-related illnesses based on individual vulnerability for every facility. We also have the National Health Mission, where they propose and ask for budget through the program implementation plan. And there also you can see these documents are available in the public domain, where you actually see states asking for funds from the government to set up heat stroke rooms and beds, to set up cooling mechanisms and also carry out training. So we are also kind of looking at states who are also asking how they can equip their own systems to deal with heat-related illnesses. Now, if you were to look at, if you ask me whether they're ready or not, the answer is not as simple as just a yes or no, because there are gaps. When I talk about gaps, I would like to talk about the vulnerability adaptation assessment for sure. So we saw that there are people getting missed. There are people who still are combating heat to an extent that it's not being recognized. So even if we have policies in place, there is a need to validate these policies implementation, and that I'm sure will vary across health facilities, states, districts, and centers. So when we look at local VNA assessment, what was found is that especially in the heat action plan, which I think assuming Lara's talk will talk about, but I think that she'll also agree with me where 95% of the heat action plans lacked a local contextual vulnerability adaptation assessment. And why a vulnerability adaptation assessment is required is because budget is limited, resources are limited. So whom we need to cater to is extremely important, especially for a health system on a government health system. So having something like a system where we utilize, say, a CBAC form. A CBAC form is a community-based assessment checklist that community health workers and ASHAs fill, where they record the needs, resources, and comorbidities of the community that they serve. We could probably piggyback on the same system to capture local vulnerability factors that can come, because this is something just saying that conducting VNA assessment will not just work. We need to kind of piggyback on existing systems to capture this data. Again, setting up heat stroke rooms, what I found in the policies were more focused on higher facilities. We need to bring it down lower, because even though these guidelines do mention how an ambulance and how a higher facility can, say, cool the patient down, but as you know, 108 ambulances are quite limited. And once the heat wave starts or the heat summer start, you will have a very high patient burden walking into your facilities with heat-related illnesses. And especially in the urban areas, I wanted to highlight that due to the heat island effect that even Mayank was talking about, the burden of heat illnesses is much higher. So with mass construction, with overcrowding places where we have informal settlements like slums, taking first aid training to communities to these working groups. For example, Mumbai has an extensive metro construction going on where you have groups of people working sweltering heat. So if we could just, if a health person just went and say trained one or two people in that group itself on how to manage first aid at that level, I think that itself would reduce the burden. And I do believe that a health system preparedness, a major part of health system preparedness is also prevention, that is reducing the load that comes in as well. And naturally, the most significant gap is also the HRH gap, that is the human resources for health shortfalls and deficit that already exist in our system that will naturally apply also to the barriers of health system preparedness for heat. So this has been some of what my take is regarding the preparedness aspect of, at least the health system preparedness aspect of heat.
Thank you so much, Atmika. The very significant point that you brought out that stood out to me is decentralizing the idea of heat preparedness from these large district hospitals or big public hospitals and then taking them to the community as well as the small centers that serve the people. And they most of the time tend to be first point of contacts, and those areas should have good preparedness as well as you said, like people of the community itself leading and learning and understanding how to prevent and give first aid. So thanks for bringing that out. Now let's go to Lara. Lara, I would like to ask you what are heat action plans and whether they are adequately protecting the vulnerable and the marginalized people.
Um, so thank you for inviting me. And just to continue from what, Aatmika said, the heat action plans are like policy guidelines that have been brought in order to respond to heat waves. And heat waves is the metric that is used for determining extreme heat wave events that we recognize in the Indian policy currently. Now, there is a huge debate on whether that metric is sufficient or not sufficient, because heat waves, if you see, are declared by the Indian Meteorological Department. The IMD is one of the functionaries that does this work of, of providing alerts and early warning as far as, increasing heat is concerned. Is based on, a metric of determining when to declare a heat wave. And that is 40 degrees temperature if it is in the plains, 30 degrees if it is in the hills, and 37 degrees if it is in the coast. Now, this entire metric, which has been developed by the IMD first and foremost itself, is faulty because it fails to capture the extreme heat, events that, the extreme heat as well as the, rising temperature impacts that take place on local communities. Now, one of the very important ways of looking at, impact on local communities of heat is to look at the heat index. Now, there has been a little bit of a departure because of the conversations that are taking place through the scientific and environmental domain on how the measuring of heat waves is inadequate to address the heat impact. This conversation is something that is coming in. Like if you see, very recently, the Thana, heat action plan came in, which actually talks about, looking at heat index and how to depart towards heat index mapping. And that is CEW is involved in, making of that plan. So if you see, there has been conversation on this. But the existing metric on heat waves results in, first and foremost, absolutely no protections being granted under the heat action plan unless and until the heat waves are declared. So if you're saying that the extreme heat has already started way before the heat wave, indicators actually kick in, then there's a very huge gap because it means that there is absolutely no measurement. There's no measurement for that kind of rising heat that is taking place, and people are getting left out because of that. The second thing is if we look at how these heat action plans are formulated. Now, what do these heat action plans actually do? They provide a response mechanism And by that, okay, they speak about first alert. Now, this is a very important thing, declaring that there is heat so that the government machinery gets into action and starts implementing the various safeguards and protections that are provided in the heat action plan, right? The second thing is to have the existing machinery, have the capacity in the existing machinery, and to have the process and the guidelines in place, which will kick in the event of, anyone reporting, impact of extreme heat. Like, for instance, to have the public health machinery set up, to have the local municipal machinery, respond to it, to provide for preventive, steps to be taken. So all of these things basically need to be put in place, and that's what the heat action plan tries to do. Now, what it doesn't focus on is very important as well. For instance, on the long-term impact of heat and long-term arresting of heat impact, which is very important. Now, the long-term measures, when we talk about, actually mean reducing the heat concentration, which is taking place, for instance, in urban cities, which Mayank spoke about. Now, you have, and that's what actually heat index also goes to capture. Now, when we talk about heat index, it doesn't just look at the temperature. It goes beyond the temperature assessment and then looks into, the humidity. It looks into, the congestion of the area, the availability of, a shade. Now, all of these things are extremely important to determine, heat index. And this is very important to also understand the heat impact that can take place. One very important thing, that we see, we see these indicators, where we see IMD's indicators also when they come up on the weather app. We see at one side there is a temperature which is given and the heat condition which is given, right? But however, there is also an other line which is written, feels like so-and-so temperature. So while it is actually 38 degrees, okay, it might feel like 45 degrees. So there is a recognition that every place and every city and every area, okay, is impacted not just by the temperature increase, but by the manifold other, other aspects which actually govern the way in which heat impacts an individual. Like, where are they located? What is the humidity over there? Is there enough green cover over there? Are you in a congested environment? Are you, is there a lot of heat trapping in the city? All of these things also determine, like in a city like Bombay, humidity plays a very huge role. Now, heat waves almost don't get declared here. You see, almost don't get declared here, but humidity plays a very huge role over here. So there is also a color coding system which has been provided, yellow, orange, red, all of these codes that have been provided in the, in this entire metric. But if we see, again, that does not represent the intensity of heat that people face. So there is a foundational or basic problem where heat impact itself is not getting recognized. So there's a very huge gap. The second is that the heat action plans itself are inadequate. And the third thing is the, not arresting the causative factors of increasing heat. Are we arresting the emissions? Are we changing the developmental policies? Now, that becomes an extremely important part. And I think I'm going to, talk about that a little more later, but I'll stop for now here.
Thank you so much, Lara, for bringing out the point that like heat waves are declared, but they don't use the right metrics. So they're declared much less than what they should be. And also, this thing that I keep noticing is that when IMD sends these messages, it's always a message and it's on a smartphone and it's in English. And it's definitely not going to reach your like migrant worker. It's not going to reach like domestic worker. It's not going to reach many people who could use this warning much earlier. So there's also this technology and English focus that is keeping out people. So the next question would be to Gayatri. Has there been any trends that we have observed in heat-related morbidity and mortality in the recent years? Have they been increasing or?
Yeah, I definitely think that Lara, Mayank, maybe Aatmika are better equipped to answer, but I'll do my best. So there was a Lancet countdown report in 2023, which showed a 108% increase in heat wave days for infants and the elderly compared to 1986 to a 2005 baseline. And heat-related deaths among people over 65 have risen by 85%. And these are all extremely concerning sounding figures, but still they are grossly underreported. So in 2024, only 143 deaths and 41,789 suspected heat stroke cases were officially reported by June. In 2022, so I realized that many, not in this forum maybe, but in many other places, to make any kind of impact, we have to talk about GDP and how it's affecting income, because individual lives for me matter a lot, but to make any kind of difference to people in power, you have to talk about statistics. So let's say that the world lost about 490 billion working hours due to heat. So if the people in power are only concerned about how much productivity and efficiency we can, produce, then that's 490 billion working hours. And India experienced an income loss, which is equal to 5.4% of its GDP, which is the highest amongst all the G20 nations. And projections show that we can lose about 34 million full-time jobs by 2030 due to heat stress. So it's much worse in simple terms, and it's also grossly underreported. And just before we move on, I just want to address one more thing which I forgot, which was in your previous question, which is who is the most vulnerable. So I spoke of pregnant ladies, and I spoke of very newborn children and elderly people, but also pretty much anyone who is on a low salt diet. So if you have something related to your heart, or you have high blood pressure, or you have a kidney issue and you're on a low salt diet, or you're on a medication that makes you eliminate water. So for us, that would be like in medical speak, that would be diuretics. So if any medicine that makes you pee more, all these things make you more vulnerable to heat stress. And so these are the people who need to be a little bit more careful.
Thank you so much for talking about this, Gayatri, because obviously, like it's not just about working in extreme heat, right? Like people do not get to rest because nighttime temperatures are more, and maybe power grid failures and maybe not having enough money would ensure that they're not sleeping well, and because of that, they're also unable to go to work, which is yeah, like defining these things using productivity metrics is not really the right thing to do, but then again, that's what people in power listen to. And as a physician, I would also like to say that people who have fevers are also likely to develop heat stroke, because like the ambient temperature is high and like you're having fever and you cannot sweat to sweat off your fever like you would do normally. So anybody who has fever is also highly likely to get heat stress. Um, Now moving on um, to Mayank. Um, I want to ask you about how the current development plans and city planning is contributing to these trends. But before going there, I want to point out this other thing that you mentioned about how women and heat stress is a completely different thing, because women work in the kitchen and they work in oftentimes poorly ventilated kitchens. And like I feel also women's work and the kind of importance we give to women's work is so low that like people don't really consider having cooling solutions in the kitchen. um it's a funny personal experience. Like when I got married, now I had first come to a joint family. My mother-in-law was the only woman in a house full of men. So she used to suffer a lot in the kitchen. The first day in the kitchen, I understood that something is wrong here. She can't continue to work. And I kind of tried talking to the boys about it, and they were not listening. So just one day, I told my husband, "Today you make the rotis." Just one day. He came out, switched on the AC, drank, poured himself like this big glass of cold juice, and then he said, "Kal wahan pe fan lagega." So like women and heat is a huge thing. So, Gayatri, you're raising your hand.
Yeah, I just wanted to say that because Mayank said that it's an entirely different conversation. I didn't want to even start talking about it. But another important thing, like you said, is not just, I mean, it's cooking, right? Women tend to spend a lot of time cooking. It's expected of them, even cleaning, sharing sleeping spaces, but also think about clothing. We are expected to have many additional. It's completely okay for a man to take off his shirt, but it's completely not okay for women to be able to do that, whichever class, socioeconomic class or caste you belong to. So that's an added thing for women.
Thanks for pointing that out also, Gayatri. Okay, so Mayank, let's talk about development policy.
So let's take it one by one and lot to unpack. Just to start from where Gayatri and you just spoke about women. The reason I said that it's an entirely different conversation because this 2 hours is not going to be enough. Let's be very clear. And let me also point it out. Let me be the devil's advocate. You said the first conversation when we spoke about women, we spoke about kitchen. Why? Are women only in the whole scenario that we talk about the urban areas? Are women only subjected or limited to the kitchen? Not at all. They are outside. They're every single place they're there. And as Gayatri pointed out, women can't take or like we have so many cases where men take off their clothes and they have nothing to be fearful about, but a moment a woman comes into different kind of clothing, she is pointed fingers at or labeled, etc., etc. And it is not just about being outside or doing a particular kind of work, it's also about the added responsibilities. Let's say a working woman also has to handle the child, the also has to also ends up handling house, job, child. So it is that she's, let's not make a superwoman out of it, because she's actually doing three jobs together at the same go. It's not just one job. So that's why I said women have a specifically different the impact of heat and the way she faces it, the gender faces it, the way it's not just the impact, it's also how she's able to, she has the agency to take steps for cooling, no matter which class or caste are we talking about. No, she doesn't. So as you just pointed out the example, right, it was not a direct straight call. So that's why I said that's a very, very different example. And is our policies cognizant of this? They may mention, but our policies are developing trends, taking care of it. I will reserve my comments on that, but let's come to the larger, let me throw some numbers. 30th April 2024, if I remember it right, there was a WRI analysis which said around 800 million people in India, which is about, say, 60 to 70% of India's population, experienced temperature of about 39 to 40 degrees Celsius temperature. Okay. That's one number. As far as I remember, Lara, correct me if I'm wrong, and anybody else, heat is still not a notified national disaster.
It
It
isn't.
isn't, right?
It isn't.
Yes. I remember last year, Tamil Nadu had called it a state-specific disaster. And why this is important when we talk about heat island effect, why we talk about urbanization. If you have a condition which is not recognized as a disaster, how do you take those measures? Okay, and it is not just an impact that due to intense heat somebody died. It is not just that. As I keep on saying, we have so many different threads. We need to connect. Let's say I had opened something. Let me just tell you why I keep talking about this domino impact. The heat takes impact. The impact of higher heat takes toll on the digestive system disorders, appetite, and then it suffers. People start suffering from sleep disturbance, mood change, depressive symptoms, cognitive decline, bronchitis, pneumonia, lung damage, because it impacts the respiratory issues. So it is not just one thing. We are not even looking at the cost of the urban heat island effect or intense heat on the overall health. What happens, like, let's say all this heat impact happens on people, they impact the health of people. Where is the cost? Imagine the cost that people have to pay to mitigate the impact or to tackle the impact of this heat on their health. Who pays for that? And if that much amount is going in health, imagine the impact on the economy. So if we are not able to address these small things together, we will lose out on the larger conversation. And why, when we are talking about, the plans, the developmental plans. Another number, let me give it to you. I spoke about it. I have the exact number now. Right now, about 350 to 400 people live in urban areas. And this number within the next 25 years is expected to touch 820 to 830 million people. Imagine the number that we are looking at. Where is the space? We are losing out in the space and we are only creating concrete jungles. So the short answer to your, or I have given a very long answer, but let me just put it in one line. No, our policies or the plans that we are making for urbanization or tackling urbanization is not addressing heat as the larger problem. We are doing a great lip service. We are doing a lot of things on the paper, but when it comes to actual development plans, we are not adhering to the guidelines or the larger solutions that are needed.
Okay. That yeah, the expansion of the population in urban regions does sound a little scary, the way you put it with the numbers. Um, and also, I understand why you mean that women in heat is like such a significant topic, because like again, you think about it, sanitation is not good. So women who go out to work, they're not drinking as much water as needed, because where would they use the restrooms? And women in rural areas, they'll have to not drink water at night because they won't be able to go out at night to use the restroom. So similarly, a lot of cooling measures are actually not accessible to women. Speaking of this, we'll move on to Lara and ask you about the current developmental policies and what a climate-centered development policy might look like.
Yeah. So I think Mayank, said it right in one line that they're not adequate. And that is, what we're seeing in terms of the scenario. But what is most scary is that they're getting worse. I think that is something that we don't, look at, is how there have been massive dilutions in the developmental policies, dilution of protections in the developmental policy, dilution of restrictions, dilution of prohibitions. Now, these were there within the developmental policy in order to ensure that natural areas, no development zones, etc., were kept intact in order to ensure that there was green cover, that ecologically fragile areas were protected. Now, what we're seeing, however, is that the developmental policies and developmental plans are increasingly taking over all of these zones and converting them into special development zones or residential areas or survey areas to facilitate construction. Now, it's not just about, what the developmental plans and the policies basically say, but there are also other laws. Like you have laws, which govern the environmental law domain. You have the Environment Impact Assessment Notification of 2006, which has faced now close to 150 amendments in the last decade. Now, these amendments basically increase, give allowances for increase in construction time by increasing validity of clearances. These basically allow for, building constructions as well as setting up of industries or infrastructure projects without going through the 4 rigorous steps of environment impact assessment process, without going for public consultation, which is a very valuable tool, which can actually prevent bad projects from coming in, especially those that destroy the environment, that destroy the tree cover. However, these policies have been diluted. Similarly, we see, like, for instance, in Bombay, one of the biggest, impacts have taken place by the coastal regulation zone notification changes that came in. Huge amount of amendments in the coastal regulation zone notification of 2011. Then they even brought a new policy of 2019, bringing in massive amendments, which basically allow for areas where earlier you could not, do construction, like for beyond 200 meters of the, high tide line. Now it is like, you can do it well within that area up to 50 meters. There are constructions which are even happening within. But those are different things. It has eased the granting of clearances or eased up those areas for construction. So what would have otherwise been illegal to construct over there has now become legal. Now, who is exploiting this? This is all being exploited commercially by builders, by real estate sharks. It is being used for infrastructure projects. There have been amendments brought in to allow infrastructure projects to happen within the coast, even as we see one of the bigger impacts of heat is the rising what do you call sea temperatures, which is leading to storms, which is leading to floods, cyclones, which is breaching the the coastal areas. So these impacts are actually happening because there has been regression in the developmental policy and removal of protections in the protective policies, like the ones governing environment protection, coastal regulation, forest diversion, which is taking place because of the amendments that have happened to the Forest Conservation Act. We don't need to just have an urban centric discussion. What is happening, in fact, in the ecologically fragile areas, in the rural areas, is far worse than what is happening in some of these areas where we have mechanisms at least to deal with the impacts. Over there are no mechanisms to deal with the impact. So the policy shift that we are seeing is actually permitting more heat impact rather than dealing with it. So while the NDMA had declared in March that they've come up with 300 heat action plans and 300 heat action plans, like in 300 districts, right? Now, all of these things sound really good. Having these kinds of documents obviously do to some extent make us feel confident. But where is the policy to support it? Where is the in the Disaster Management Act? We do not have heat waves recognized as disasters. What does the Disaster Management Act do? It provides for a response mechanism. It provides for compensation. It used to provide for loan relief. Now there have been new amendments which have come, which all of advocates all over, activists all over try to oppose. But that has removed even the loan relief, has diluted compensation by converting it into relief. So anyway, those strong provisions that existed within the National National Disaster Management Act have themselves been diluted. But apart from that, heat wave, even in its whatever erroneous form today, does not figure within the National Disaster Management Act. Now, in the National Disaster Management Act, there is a mandatory mechanism that is sought to be provided. Of course, then by the time the national disaster plans come in, or the state disaster plans come in, or district disaster plan come in, we again see the non-implementation happen. What is happening with the heat action plans is the same model. You have these heat action plans, NDMA is involved in it, IMD is involved in it, state government is involved in it. All these things have been written in the name of heat action plans, but are they actually translating into reliefs to the people is where the question comes in. There's one more point I wanted to make is that how do we see these heat action plans being implemented for vulnerable communities, right? And when we actually look at any kind of alert system, early warning system that is provided, which warns communities of the impacts of heat, do you think informal sector has the liberty to take off, not go out and work because there is a heat wave that has been declared? There has to be prohibitions. It has to be mandated. The onus has to be carried by employers. It has to be carried by contractors. It cannot be put on the citizens. So there is a very huge gap here that we are talking about. Where are the mandatory provisions that make the employers liable, contractors liable, if they force workers to work or if they continue with construction activities even after a heat wave is declared? Now, all of these things, again, will come only through enforceable policy. What we need today is enforceable policy and not just guidelines.
This is one of the most important things that's come out of this discussion, which is that heat action plans are policy guidelines. They're not actually policy. And policy as it exists is weak, and it's gotten weakened further over the years, and has also allowed for more heat impact rather than protection. So thank you so much for bringing that out, Lara. I'm going now to Aatmika to ask you whether there are any early warning systems to the public health system, whether health workers get told about whether that there is a risk for a heat wave, or if there are any response plans that hospitals or even any other community health centers have been trained to act on.
Yeah. So I had a lot of points that kind of already have been covered by all of the three of them. But so I'll just maybe say things that are from the health system perspective. So the heat early warning systems linkages in principle has been established between IMD and health facilities. Particularly if we just look at the Ahmedabad Heat Action Plan, which was done in 2013, they have institutionalized early warning system and also implemented interagency action for heat. So Ahmedabad is that one place that all of the program managers, nodal officers that have been running the national program for climate change and health have been visiting to learn what Ahmedabad city has been doing. So essentially, I'll just summarize what is institutionalized in their system in terms of heat warning systems is that you have the temperature forecast that triggers a heat alert, which then informs the municipal corporation nodal officer, which who then issues a heat alert as an intervention, and all of this information goes to multiple line departments, health being one of the first ones. You have labor, you have water, you have school that also receive these warnings. So a similar policy and a model has been in principle adopted in all of the heat action plans. But whether this information is reaching the health facilities and health workers until the last miles will have to be validated and seen further. Also, the heat health early warning system cannot be again merely on ambient temperature. We did talk about the heat index. Lara, I think, extensively spoke about the heat index, which factors in temperature and humidity as well. But interestingly, what has also come out of Ahmedabad Action Plan is also the threshold estimation, not only for just heat indicators, but also health indicators like deaths, hospital admissions, call for ambulances. And this has been uh, used for in more than 103 cities across 19 states. And what they've picked up from the health is the death. So obviously, this would be something that has to be tuned and customized to all of the cities because thresholds will be different at different facilities because again, it depends on your heat indicators and also it depends on your health indicators. So what you kind of put into the system is where your threshold will have to be determined. But there's an entire guidance document as well that has come out of how this can be determined. But the pertinent gap that I do see with this particular system is whether this information is reaching last mile or not, whether our ashas, whether our community health workers, where actually the action needs to take place, or our, for that matter, our Ayushman Bharat health and wellness centers, where our community health officers are there, whether they have access to this information or not is would be iffy. Then let's come to I think the next part of your question was whether there is a response plan. Yes. So already, as I said in my previous question and answer, is that response plans have already been institutionalized. But if we were to look at, say, dissemination of information and public communication strategies, I would say that a generalized pamphlet and information is what is being picked up on by the states, but that's also contingent on funding. So again, piggybacking on, say, existing system. For example, we have the garbage truck that goes out every morning, which already has a miking system that already sounds a particular audio. So in that audio itself, if the heat wave alerts and warnings can be put into it, you would again have that kind of dissemination of information. So you wouldn't require additional funding. You don't require additional funding from government to kind of use that because you already have a system that goes with miking every morning to the communities. So that could be one of the ways. So I do want to, I mean, this doesn't really exactly fit into the question that you asked, but I did want to make this point. I hope you allow me to do that. So I do believe that some of the field jobs that are done by one person and that being agriculture, because agriculture is one of the major sectors that we have. So it's basically one person under sweltering heat who is working. So we could have all the preparedness in place, but access still could be an issue. So we do need heat adaptation measures like setting up cooling rooms, water sources in the community itself. That becomes essential. So one person in the sweltering heat doing agriculture could faint, but what would a health system preparedness do for that person anyways? Unless somebody in the community, say a panchayat ghar or say a Jal Jeevan Vihar or some sort of facility have like cooling stations or water sources installed over there. And this particularly again comes back to the point that I made previously. I don't know here if anybody has been to a urban health facility, specifically in a slum area. It's itself is a hot box. So it would be like a health facility or a mohalla clinic would be like this tiny place with one nurse and one doctor sitting, and with like hundreds and hundreds of people coming at them in sweltering heat. And if you anyway try to manage this crowd, it would just go insane. So you also have an uptick in violence in healthcare when you see heat also that happens. So it's very an extremely important that we kind of reduce the burden for among urban health facilities, which also becomes very important part of preparedness. One another thing that I actually want to just quickly touch upon is heat poverty. So what we would essentially see is that heat poverty is a growing threat that we would see among the population. So what we would have is that in rising temperatures, we would have people from the lower socioeconomic background forced to say take AC, air conditions, coolers on credit and loan, which also means that that's taking away vital money that they could put on health and other essential expenditures, where they, if something does happen, they would visit a burdened health facility. But if they're not happy with services, they go to private hospitals, which again would again push them to a cycle of poverty. So heat poverty itself is going to be the next big global threat if we don't start acting now. We do have a lot of examples where we have advent of parametric insurance that has come out, where we do have a few firms and self-help groups which have instituted payout to women in the informal sector. That is, they receive a certain amount into their bank account once a certain threshold of heat is achieved or temperature is achieved, so that that itself can help them to build resilience and have adaptation measures. So taking heat coping and cooling practices till the community, it becomes really important for, as well, for health system preparedness. And if we had to look at the response plans, I think one glaring gap that I found was that there are no preseason mock drills that should be in place, because again we need to know how triaging needs to happen, how the flow of patients need to happen, especially in these urban health facilities where you just have hundreds of people just coming at you. And one last point is that medical colleges need to train their interns and staff in handling them in the emergency department, because it is these interns who will be entering the workforce in the next year to PHCs, and they're not going to get trained anywhere. So training them right at the medical college would be really beneficial.
Yeah. Thank you so much for that answer, Atmika. Thanks for bringing up this point of heat poverty, which seems like a very pertinent threat in the days to come. And thanks a lot for setting me up for asking Gayatri the next question, which is that are frontline workers adequately trained to recognize and treat heat-related illnesses?
Yeah, I think I'm going to echo everything that Lara and Mayank and Atmika has said. So on paper, we look really good. We have a lot of action plans and advisories. Um, there is no last mile. I mean, it's not reaching. Um I have not seen any. I'll reframe. Whenever somebody has has, let's say, some kind of heat related illness, ideally they should be going to a primary healthcare setup, right? A primary health center, a health and wellness center. But as a country, we tend to run hospitals which are serving both primary, secondary, tertiary, all levels. And our government health infrastructure is not catering to most of our needs. Let's say many of our needs. So it's, if you look at it in terms of, so there are training manuals, there are virtual refresher trainings. I found some 3-hour long videos on YouTube. So on paper, everything is being done. And from my perspective, this framing is like we are talking about a heat wave. It's like, let's say, a cyclone or a storm. So it's like we are looking at it, even though it's not under the Disaster Management Act, you're still looking at it as an isolated event. So the framing is short term and reactive, and it's not really reflecting the larger sustained environmental and health shift. Frontline workers, uh, I I have not met any ASHA workers who know anything related to heat illness. And whichever PHCs I have visited, I have not seen any heat stroke rooms. Even in tertiary care centers, I don't know how many of us have seen heat stroke rooms, cooling systems, hydration stations. Uh, and maybe we have clear referral protocols on paper, but definitely 108 does not have the ambulance that is most accessible, does not have these mechanisms. Very often 108 doesn't have any water at all, even for oxygen humidifiers and things like that. So we are talking about a gross, there's nothing there. I want to say gap, but essentially that last mile from between paper and actual working on it is not there at all. I'm not being very articulate, but I think Lara has also mentioned this earlier, that we are not being able to convert any of these advisories or plans into action. And most of all, like in every other field, we are slowly becoming a country that is more and more serving the privileged 2-3%, and the rest of it, it's basically not even the 2 or 3%. I feel like saying that the country is living as like it's YOLO. So we are just looking at today. We're not looking at long-term effects. A lot of contractors, middlemen are gaining, but the rest of us, the rest of us are just are not in such a great place. If you, and this is something that others have also mentioned, if you look at it in terms of a leaking tap, there are lots of these floor mopping measures, and a lot of onus is being shifted to the citizens, to the community members. And we are often told things like, don't use public transport, don't litter, don't use your air conditioners. And these are all valid things, and we all definitely should look at how to do more of these things. But let's say today, miraculously, our policymakers decide that we are going to address climate change, and all our policies cross-sectionally are going to be climate change oriented. It's not going to make a difference unless all the countries together decide this. So we are already in that place. Plus, our policies are not designed, and we are being floor moppers. We are not being tap turner offs. That's the analogy I'd like to use. And so I feel that even in I try to look at what the Ministry of Health and Welfare has given as guidelines to the community, what they can do when there is a when there's a heat wave. Because what we can do in hospitals, for me, that should be the last thing, and we should look at what we can do at home, and it always starts from there. They have talked about putting a bowl of ice. Most people don't have access to ice. For ice, you need a refrigerator. And they've talked about keeping windows open. There are way too many mosquitoes to keep the window open, among many other issues with keeping windows open. And we are talking about people who live in extremely cramped spaces in urban areas. And even in rural areas, sometimes you just can't keep the window open. There are many issues with that. Using white curtains with the white facing outwards. I don't know how many people have the luxury of having curtains. So all these are things which, I mean, you are then asking people, you're literally telling the rich 2% that you can survive this heat wave, and the rest of, I mean, the rest of people, rest of the community just has no avenue. And I'm sure all of us have enough stories um, uh, that will illustrate this fact over and over again. You know, like the ASHA worker I'm in contact with having to take a loan to buy an AC. And obviously that will, all of it is out of pocket expenditure. Most of healthcare in our country is out of pocket expenditure. So I don't want to keep rambling on, but I don't want to end on a despondent note. So I will say that what people can do and what we do need is contextualized and not vertical programs, but contextualized bottom up community based approaches. So like in some areas, there's a lot of khas vetiver that is available. So that can be cooling. What can we do in a place like Mumbai where there's so many mosquitoes? Everybody is living in a small one room, many big family living in a small room. Can we use some kind of net? Again, just giving out free mosquito nets is not going to help. There has to be a community, like one of the women, a community of women or community of people making the mosquito nets, and therefore they end up using it. So there are many community-based approaches that can be effective, and if they are contextual. And just to finish off, if there is somebody close to you who is experiencing some heat-related illness, the best thing is to make them lie down, remove their clothes, elevate their legs, and try and cool their temperature down. If they're confused, don't try and give them any water through their mouth. Just take water, not extremely cold water, just cloth soaked in water, and start applying it like you would do for fever. And I think that that's the best I can offer right now in terms of short term. And yeah, I hope, like Atmika said, we start training more and more doctors. And we don't really need doctors. We need more people from the community who know how to manage heat-related stress, heat-related illnesses. Thanks.
Yeah, just to reiterate that Nivarna is not sponsoring anybody's therapy sessions if you develop climate anxiety after this. Anyway, um, this other thing that I would like to say as a doctor is that, like, what I've seen is now nobody really knows how to identify heat related illnesses. Like, people come with cramps, pain, all these vague fatigue like symptoms, and like not really anybody thinks of heat as one of the initial causes. And there's this other thing that a lot of PHCs, they don't have refrigerators, places where you can store cold saline, and every other measure that even doctors are taught how to cool a patient, like those things are not available. In fact, a lot of heat related illnesses are not declared because places don't have thermometers. So the infrastructural strengthening for heat needs to be really planned out quite in advance during the colder times, with like funds being allotted and these plans being made, I guess. So speaking of that, like I want to move on to Atmika and ask her about how or whether climate budgeting, especially in terms of public health, is happening, or like should it be a priority? How do we make heat resilient systems?
Yeah, thanks, Jan. So I'd start by saying that COVID-19, the pandemic, sure everybody agrees with this, shed light on what exactly happens to a health system when they're not prepared for emergencies. It could particularly fracture a weak and a fragile health system further. So health system absolutely needs to be a top priority infrastructure that needs to be resilient and adapted to the changing climate. So again, I'll talk about policy. So in terms of policy, the ministry has come up with a guideline to budget for a climate resilient health system, covering what kind of logistics should be in place and infrastructure should be in place. But and also there's also some isolated work that is done by non-profits, research institutes, where they've come up with tools that health system can use to assess their risk and accordingly budget for what they would require to build a climate resilient health system. So the problem with the climate resilient health system is that it's not just about knowledge, it's just not about capacity building. You need very tangible things to build a climate resilient health facility, which is you need infrastructure. You actually need like water and pestle stuff, like to actually just, say that this is a climate resilient health facility. So, speaking of sources of financing, we do have the National Health Mission, where states do put up a budget for what they want to undertake in terms of climate resilient systems. And if you analyze these PIPs, that is a program implementation plans that a lot of the states have put up, you would see that solarization is something that a lot of health facilities have suggested, but not all facilities can budget for it because solarization one-time cost is expensive, but even though later it might be cheaper, but setting it up itself is going to be a little expensive affair. So not all health facilities can do it, but they have put a certain number of facilities that they want to solarize under the National Health Mission funds, and they do manage to get some parts of the fund. Another source that is the Rogi Kalyan Samiti, which is the patient welfare committee funds that are already there with the health facilities and health systems that can be utilized for infrastructural climate resilient structures that need to be built, as well as annual maintenance grants and untied funds. Within the program implementation fund, also that states get, a lot of the times the budget that is given might not get utilized for other programs, so they can also reappropriate some of those funds to kind of help the climate agenda. Um, I did want to shed some light on solarization because that is one of the key focus of the action plan and the program itself. And solarization is going to be a future. But what is more interesting is that solar mission is also one of the most pertinent missions under the national action plan of the country itself. Country is also looking at expanding solar energy and being a pioneer at getting energy from these renewable sources. So we have a same agenda thing from a different sector. Like for example, there are already existing schemes that exist in the energy power department that can be utilized, and you can prioritize health systems, saying that health system is the place where you come to when disasters happen. So that health system, schools, all of these places need to be your primary high priority facilities that need to be solarized. So cross-cutting centers, funding schemes can be tapped into. For example, Niti Aayog's aspirational district, you have tribal department, you have urban local bodies that have their own funding, you have panchayat bodies that have their own funding. So those fundings also can be tapped in by health systems that to use financing for building climate resilient. So CEW also has come up with, the council also come up with a climate risk, like climate risk system, where it has laid out which facilities in which states are more at risk or exposed to or hazardous for climate change. So also it would be good idea for the government also to look at such high resolution documents where they can actually see where the fund is required more to build climate resilient health systems. So I would like to end the note saying that climate change is an everybody problem. It's not just a health system problem, though there has been an accelerated focus on climate change because health came into picture, because nobody wants to die. So just saying that, oh, so many people are going to die or health, climate change is going to affect everybody, probably has drawn more attention, which also goes to say that private players need to also come in to kind of support government facilities. So a blended finance model where we have, say, private companies that can fund through grants or philanthropies can come forward and help public health systems to be resilient. So that can also be an upcoming area because another important thing that's coming up right now is the carbon credit. So private companies can also show that they have supported something like this for health facilities, and also like make money by giving carbon credit. So just to explain short, what is carbon credit is that if someone is not doing is probably like reducing the greenhouse emissions, they can sell that credit to a company that wants to do greenhouse gas emissions. So the private companies can make money out of it. It's not exactly mainstreamed at the moment. It's just coming up in India among private companies, but they have the access to do that. But I think we might, as well as a health system, benefit from something like this and get ourselves a good infrastructure process. So, yeah.
Yeah. Thank you so much for talking about these things, Atmika. Like, it's building climate resilient health systems or any system would not just be isolated in the sense that it is not going to only be climate focused, right? Like, build health system lacks a lot of logistics. Like, building up climate logistics will automatically improve logistics for every single thing, including referrals, having good infrastructure, being able to handle other kinds of cases, etc. So and solarization as well. Lara wants to talk about solarization and heat action policy. After that, Mayank will close with talking about any successful models of urban development with which is climate centered, that has been happening, so that we can look at something positive before we go. So, moving on to Lara and then Mayank for closing.
Yeah. No, so I wanted to actually come in with a warning, because when we talk about solarization and just transition and all of this, it really sounds good. What is actually happening is very different, right? So India hit an all-time high of coal production. We had a 7.6%, I think, increase in coal production in the last fiscal year to 1,040 million what you call tons. The year before, I think we were at 997. All right. And that was already 11.6% increase. So we are looking at, we are increasing our coal production. India is also the third highest emitter in the world. All right. So it's not like because we are moving towards solarization, or we have been moving towards solarization for the last several years now. Okay. We are decreasing our emissions or decreasing our coal production. That is not what's happening. We are increasing it. So there is no transition that is happening. It is not phasing out the, renewable energy, what you call exploitation that is taking place. It is not phasing out anything over here. It is only creating a new market. It is only creating a new green market for exploitation. And even the solar projects that are being executed, these big solar parks that we are seeing and all of them are extremely land intensive. They're happening in eco-fragile areas. There are local communities which are fighting these projects. And these solar parks, these solar power projects are extremely unsustainable. They're not going to help us in terms of the heat impact. What is actually going to help us is community-led solutions, and what is going to help us is looking at, community-level interventions, which Gayatri also spoke about in the context of health, but that is also true in the context of environment and climate. So a lot of what is happening through this narrative of looking at, this move towards solarization, this entry of, private interests in the field of transition and energy. Also, in terms of, let's not forget that, all this coal production has been possible, this increase in coal production, because during pandemic, an opportunity was found in the name of Aatmanirbhar Bharat by the government to allow for private auction of mines, which was not allowed before that. So, we're trying to look at an industry and a government as a savior, which is actually moving us towards a path of, of environmental destruction in terms of our resources, in order to execute some idea of a plan of just transition, which is very unjust. So my only reason to come in over here is that we have to look for the right solutions. We cannot, we cannot go on the path of these false solutions. Where they're false solutions in terms of, dealing with the, with the kind of climate crisis that we are facing. Okay, or they are, false solutions in terms of, going ahead on a very destructive agenda that has already been in play. We have to look at what is exactly going to change things, right? And I think that's where I feel getting back the focus, I think, becomes very important. Now, even the health budget, for instance, of Maharashtra is underutilized very vastly. I'm doing a case, I'm doing a PIL in the High Court exactly on that. And if we see, when we talk about climate budgeting and all of that as well, okay, what is actually going to, where are we going to draw this money from? Now, NDMA, which was a legit law to look at disasters, whether they are slow onset, whether they are extreme climate events. Of course, this does not cover slow onset events. It does not cover heat waves. There is a huge lacuna gap over here. The NDMA, which was supposed to look at that, provide funds, is becoming more and more centralized with the new amendments. Okay, it is not releasing the funds at state level because of this over centralization. This is exactly going to be one of the outcomes of it. On top of that, it is not including many of these climate-linked calamities or climate-linked events, these slow onset events, the heat waves within its fold. So its funds are not going to be necessarily directly utilized. It is not providing a compensation mechanism now in many ways for the community, or even loan relief, for communities whose livelihoods and whose properties are affected by, and who are put into the credit system because of these kind of events. So what we have to actually ask for is strengthening of mandatory policy, not some of these actions, guidelines. Budgetary allocation is completely on the government, right? What it utilizes money for, what it provides money for. What we need is recognition of the disaster, accountability mechanisms. And I think that was supposed to be the last question being asked to me, was on accountability mechanisms. We need those, accountability mechanisms that need to be developed within the legal framework. We need the National Disaster Management Act to recognize heat waves, if you're talking specifically about heat waves, not just recognize heat waves, but recognize heat impact on account of climate change that is taking place, on account of the global warming. And that heat impact can happen way before heat waves are declared. So that kind of recognition needs to happen. There are also other factors, other policies, which actually impact the resilience of communities. Now, for instance, labor protection. Now, we've been talking about the way in which labor reforms have left labor unprotected. I raised this question earlier also. Does the informal sector, or does a daily wage worker have the option of not showing up for work? Similarly, is there any mandatory law, okay, which makes the contractors liable and accountable, okay, if they force people to work in, even when there is extreme heat or in unsafe working conditions? What are these unsafe working conditions? Even if we don't talk about heat wave, people are working in unsafe working conditions. So where are the regulations and protections regarding that? Now, all of these things that are important, whether it is in terms of the labor protections, the environmental protections that we need to bring back, which have been diluted, which I already spoke about, or whether it is in terms of the developmental policies, which really need today a reform. We need to be able to sound and alert ourselves to the government on the heat, because at the end of the day, unless they recognize that all our futures are at stake, unless they recognize that this destructive developmental agenda is not going to be to anyone's benefit, and it's getting far too late, they're not going to wake up and look at progressive reforms. So how do we make out a case for these reforms, and how we, in our different locations, whether it is in the healthcare system, whether it is as journalists, or whether it is as lawyers, or whether it is as researchers, how do we make out that case collectively every time we get an opportunity to input? I think that is a very important question.
Thank you so much for bringing this out. Atmika had actually written a story that I have put in the chat box about the fact that India is pursuing renewable energy while pursuing deforestation and mass coal mining And so India does have what she called a split climate identity. Like it is also an emitter and also sort of like a renewable energy leader, and it's like walking two paths at once. And there is no real will and collaboration from various sectors to commit to and walk the path of ensuring that heat mitigation and climate change is really taken seriously. um, there is a question for Lara. We will take that after Mayank tells us about the examples of someone who has done development or city planning, right? I really am in need of something positive at this point.
Thank you. Okay, before I come to that, there are a few things I would like to, catch and just close that loop. I started with saying the point that we have enough laws, we have enough guidelines, we have enough policies. The where we lack is the implementation. I want to just take that up, and I'll then come to the solution or the good examples, and I'll make you feel better. Don't worry. But let me tell you the bad story first. That what we are the problem is the implementation, that a lot of our agencies, they are working in silos. That's the main problem. Lara touched upon the topic of energy transition. That is something that I have been eating, sleeping, breathing from last 8, 9 years now, and one of my favorite topics. But I'll just say, what drives, we need to, when we are having all these conversations, whether it is about energy transition, whether it is about climate, whether it is about, say, heat island, anything and everything, we need to understand how humans behave and why certain things happen in a certain fashion. So what we need to, like, in this context, what we need to remember, or what we need to just probably discuss a little more, is points like energy security, energy independence, and also we need to understand aspirations. When we talk about the numbers of urbanization going from 400 to 800 million within, say, next 15, 20, 25 years, where is it that our policies, our greed, our aspirations, our, this interplay of policy, greed, aspirations, local action, decentralized action, larger policy action, where is this interplay happening? There is a reason people are moving to urban areas. There is a reason that why they are moving. What is it that is they are not getting in their own areas that they have to move? Is it in terms of opportunities? Is it in terms of better lifestyle? How the whole interplay of aspirations happen? So having said that, it's a larger conversation we can have offline, online, another session on it. But especially energy, it's a very, very complex topic. But let me give you a good picture. There are solutions. Are we following those solutions? I'll give you solutions, but let's say give you two numbers. Delhi, 1400, there were 1400 water bodies in Delhi as like about 20, 30 years ago. We are left with less than 50% of it. And trust me, over the next, how the development work is happening, so-called development work, this 750 is also not going to be there in the next 10 years. So how is it that these water bodies, which are part of, like, crucial and vital part of ensuring a city, decreasing the city temperature, how is it is going away? It is the greed, aspiration of people building new things. It is the corruption that people are not, protecting these places. Bangalore has lost 80% of its water bodies. A city which was like called a city of lakes. 80% of city has lost, 80% of the water bodies are lost in the last, say, 20, 25, 30 years. These are all official numbers. I'm not quoting anything from on the top of my head. These are all from court papers, from parliament papers. Okay, good example, yes. Ranging from west to east, there are so many examples. We have New York, we have Singapore, we have Sydney, we have Tokyo, we have Paris. For example, there's a Singapore, what has Singapore done over the last 20, 30 years? It has planted about 7 million trees. So the answer to battling urban heat impact or intense heat impact is to create blue and green infrastructure. What is blue and green infrastructure? That primarily refers to the water bodies, or more trees, more shades, more canopies, or even look at solutions like white paint to decrease the impact of the heat. Who all has, I mean, Singapore has planted about 7 million trees, which has brought the temperature of the city, which has lowered the temperature of the city. New York has painted about 1 million square feet or square meter area across the city. to decrease the temperature. There's a place near Los Angeles which has paved the city with better material, like the asphalt on the roads, with with better technology to decrease the impact. Paris has a schoolyard project which is aimed at decreasing the temperature of urban, or basically battling, and it has been successful. Several Chinese cities have done this. Sydney has done this. So there are a lot of examples of cities successfully doing it. And I'm not talking about cities which were aspirational. I'm talking about the cities which are already considered developed areas. There's a whole conversation and debate about the development, what sort of development. But yes, the so-called development that we follow, there are cities who are so-called developed, but they have changed their future. What is required is to find a balance in terms of aspirations, in terms of solutions, in terms of, and especially we have to stop working in silos. A lot of our government departments are working in silos, and they keep on working in silos because it suits the narrative. It suits the contractor-driven development model that we have. A lot of my fellow panelists, they talk about decentralized energy solutions, which actually can help in so many ways, in decreasing the heat, in battling the emissions, and looking at more cleaner transition methods. So yes, there are solutions. What we need is to work together and not in silos, and also address aspirations while looking at the development goals and while looking at environmental issues. Thanks.
Yeah, you were talking about Delhi and Bangalore, and I was like, oh, that's the good story. Thank you for um, talking about the other cities. It's a little,
Sorry, that's not a good story. I am telling that we need more green and blue infrastructure,
yeah,
and Delhi and
yeah,
Bangalore have lost it over the last 30 years.
yeah. So it's still a little bit disappointing to know that like a lot of examples were definitely from like high income and highly developed countries. It was but like I really hope that India does prioritize intersectoral collaboration the way you did say. We all need to actually hold on to more hope that um things like that can happen here. So there is this particularly a particular question for Lara, which is, can you elaborate a bit more about community-led solutions for health?
So I think Gayatri has already spoken about this, and
Mhm.
I'm not the health expert, so I'm not going to enter her domain. But some of the things that we need to contextualize, we need to find solutions, that are that are executable within the community, that the community itself provides us, because those are the more sustainable ways that in which we will be able to deal with first the short-term impacts of heat or increasing heat that we're seeing in different parts. But there's another thing about the long-term impacts, and that is happening because there's been a departure from the community in the developmental model. The developmental model does not include the community. It just decides how the development is going to happen without consulting the community. And that's where I feel like that's a space where we need to come in and really intervene and really ensure that the voices of the community determine how development is going to happen. I think that's a very important task that is there for all of us who are playing the role of advocates. But one thing that is there is that we see in terms of Mayank was talking about solutions. And some of these solutions include increasing green cover, and planting more trees is something that even the government is saying that all of us should plant X number of trees. But one of the things that we need, and that we all will have to assert in the coming years, and I'm sure the increasing heat impact, the global warming is going to force everyone to recognize this at some point. I'm quite hopeful that it is going to happen through experience. It should not happen too late. It's already quite late. Is we need a moratorium on forest diversion. We need a moratorium on the destruction of our natural resources more than we even need to plant trees. What we actually need and what is happening today is that forests are getting diverted left, right, and center. Our water resources are in danger. There has been encroachment of the coast. There has been encroachment of, the wetland areas through the green credits program again, which is which is again a green washing scheme, but green scheme. And you are seeing that, even wastelands, grasslands, they are all being converted into, exchange credits for corporates for destroying forest cover, because these green credits you're going to get, which you're going to use to actually destroy forest cover, just for forest diversion, right? So all of this is what we will need to challenge, because we need to ask for a moratorium on this destruction. And those voices today are coming from the community. These are the voices that are actually coming from the community. It is a community today that is protecting the forests. So when we look at, indigenous solutions, when we look at amplifying the voices of the community, we are going to be able to deal with global warming and its impacts. That is the only way we are going to be able to deal with it. Gayatri also responded to this question by saying that, you have to look at a bottom-up approach. You can't have this top-down approach. And I think that goes, across the board. Because that's what's happening today, whether it is in energy discourse, whether it is happening in the developmental discourse, is that, you have these policies which have been thrust upon us, which are leading us to, this apocalyptic situation. We are actually being led to the disaster because of many of these policies. So how do we, bring that back? I think is get our agency back. Also, we also have to take this whole policy making process very seriously, the decision making process very seriously. Many of us are not involved in it, and the government, is working in silos. So there has to be. It's only with the public consultation. It's only experts entering the domain with more and more, thinking behind how to find these solutions, that we'll be able to find solutions that are going to have an impact, both in the long term as well as in the short term. Finally, I just want to make one more point. We have been talking about many things, but access to healthcare is a really huge issue. And the way in which, the healthcare has been privatized, and the way in which, the state has departed from its role as a provider of healthcare, is going to be a huge concerning issue for those suffering from heat impact, and from all its long-term impacts and the comorbidities it's going to create, and all the issues. It's just the tip of an iceberg. Having a heat stroke is probably very evident of the heat impact, but there are long-term heat impacts, right? Our health system is not catering to those at the margins who are suffering heat impact the most. Those doing outdoor work, the informal sector workers, those unable to take leaves, those unable to deal with the heat impact because they do not have the resource, those who don't have the access to healthcare. So how do we look at making access to healthcare or these healthcare systems accessible for them? I think that is where the whole crux of the matter is. Because we may have all these plans and we may have all these solutions. Maybe the big hospitals might cater to some of these needs, but where are the community health centers? What is happening to the primary healthcare centers? What is the access that people have to, these services? What are the schemes that are available to them? Are they able to access these schemes? I think these things are, the question that come in, and that goes back to old fights. These are old issues that we've been battling. As even I'm also part of Jan Swasthya Abhiyan, and some of these issues we're taking up locally at the Bombay level and Maharashtra level as well. So these are issues we're going to have to come back to doing that hard work. There is no easy solution to this in terms of heat action plan. That's the only thing I wanted to say.
Thank you, Lara. Atmika had raised her hand, and after which Mayank would also like to add something. We have overshot the time by 15 minutes. So any other questions that people would have, I've put the email in the chat box. Please write to us, and then we will ensure that one of the panelists responds. So over to Atmika and then to Mayank.
Yeah, I just had like a quick input to the question that was posed to Lara as well. Yeah, there are some community-led specifically health aspects that are coming up, one of which is the participatory vulnerability adaptation assessment. So, Parth has done, I mean, he could talk more if we have the time on participatory research where they looked at sanitation workers and they generated their own evidence. So, that is something that slowly also is coming into the climate change aspect where we ask where vulnerability and adaptation assessment comes to, from, and by the community. So, I mean, who better to tell that I am vulnerable and these are my fact indicators that I can adapt to than themselves. So that's where like one of the aspects that we have is that a few of the states that have been doing this in some way or the other is Kerala, where they have the local self-governing bodies where they have like a committee at the end level who's been discussing these issues and taking community opinions as well. So these are some of the examples where like be the answer to what is posted.
Mayank?
Yes, thank you. Just 30 seconds. I just want to add to what you were saying that all the solutions coming from the rich developed nations, there are a lot of other solutions and people are adapting to those as well. For example, from the Middle East and I think Northern African territory, there are solutions of wind towers, how cities were constructed or constructed in a way that cities become naturally cooler or how wind can be tapped. Cities like Singapore are learning and using that knowledge and bringing it in their urban planning to make the cities or to basically tackle the urban heat impact. Just wanted to add that there are solutions in other non-developed, so-called developed areas, and they are being taken by the countries or they are being adopted. Just wanted to add that. Thank you.
Yeah, thanks. I think there's this other school as well in Jaisalmer where the design is such that I think wind is allowed to cool the areas and that serves the Rajasthani women. So, Gayatri wanted to speak.
I'm sorry, I know we are all short of time. I just want to quickly address that question that Ritu asked on the chat. Um, I just like Lara said, there are no simple answers. And thing is, for any community-based solutions, the best thing to do is to sit with the community. And usually most solutions come from the community. So, and this is obviously not just heat related or climate change related. Whenever we attempt to work, facilitate community-based solutions or community-based approach, in my experience, the best way to do is to actually sit with and work with the people, with the community. Most answers come from there. Like, for example, what are the age-old traditions that their grandmothers would use to reduce the temperature or deal with heat? Those are usually local culture specific, context specific solutions. Is there a well nearby? What kind of how many like what is their forest cover? What herbs do they usually use? And so many self-help groups like this will come together to do things like local gardens, plant, starting their own thing. What this also does is it builds some kind of capacity at the community level to generate enough um, public pressure and therefore develop political will. So, like Lara also said, what is the need of the hour is a community responsive policy. So, policy changes that are informed by a community based approach. And I think that's where many things can be sorted out.
That's like the best note we could have closed this discussion on. Thank you so much, Gayatri. Like a lot of research, a lot of policy, and a lot of solutions kind of tends to assume that people at the top or so-called experts know what's best for people. But it really is important to divest from the idea and also engage with the idea that people know what's best for them and that we can learn a lot from what solutions they have been doing for ages and then and that definitely lived experience should and must count as expertise. And the fact that like people can come together and understand the need and organize and then apply pressure and demand for changes is really important. And now, even as people who are marginalized and underprivileged are vulnerable and are already facing the impact of heats, it's important to talk to them and help them vocalize their concerns and help them exert agency to ensure that these changes are brought about. And definitely we need enforceable policy that does not just look at climate but also ensures that every other policy is in alignment with what we think or what we want our climate goals should be. And we need intersectoral collaboration to ensure that um, everything works, and also definitely infrastructure strengthening. So thanks a lot, everybody, for coming here and for talking about this very vital issue. We're just about to step into the summer, and the years ahead are going to only get worse. So it's really important that we now talk about things and act within our capacity to ensure that um, um, we can mitigate what we can. And please put your questions to Nivarna's email. And thank you so much.